Stephen.
Yes, recently Seattle achieved a very critical benchmark, the U.S. strategy on AIDS and HIV. It's called 90-90-90. It's being 90% of the people living with HIV are diagnosed, 90% of those diagnosed on retroviral treatments, and 90% of the people that are on treatment are fully suppressed. And although we've hit that great benchmark, the 10% that we know left is predominantly people of color. Specifically African American men. The statistics say from the CDC now that 1 in 2 African American men will have HIV or have the possibility of catching HIV in their lifetime. 1 in 4 Latinos, men who have sex with men, may have the opportunity to catch the virus in their lifetime. What would you as a council member do to address this epidemic?
Thank you. That's a really important question. I think that the best ways to reach marginalized or underserved communities is to go to the trusted organizations that exist in our community that already hold those relationships. And what I would like to do is to seek a partnership with King County Public Health and other organizations, perhaps the Urban League or other groups that actually work directly with those populations. I think that if we can increase funding outreach and education on HIV and AIDS treatment and preventative care, I think that that's how we reach those other communities, because we have to acknowledge the fact that there is a disproportionate impact on these communities when we talk about HIV and AIDS infection. So that would be how I would approach it. I think the city needs to invest in those resources and those organizations that have those trusted relationships in those communities.
So my background's in public health, from working from the Children's Alliance, the Department of Health, to the Community Health Plan of Washington, and the work that I do now. It is fighting to make sure that everyone has access to comprehensive health care. And the fact that we have disproportionate numbers, especially within our communities of color, who are still being exposed to AIDS and HIV is something that in Seattle I think we can help address. Right here in our own city, we can do 3 things. We can make sure that everyone has access to comprehensive, affordable health care through the Healthy Seattle plan that I hope to roll out. Mirrored based on what San Francisco does, saying that no one will fall through the cracks, especially our community who's been left out of healthcare for so long. We're going to create that safety net so people have access to preventative services and comprehensive care. I think we can do more, number 2, with our schools. We have a number of school-based health clinics throughout Seattle, but we can also work with our schools to make sure that there is going to be comprehensive sex education throughout our schools, no matter what the Trump agenda is, no matter what Betsy DeVos tries to do. As you probably saw the news this morning, what she is doing is unconscionable, and we have to fight back at our local level to protect our health of our community, to protect the safety of our community, but also I think to be proactive and work with our schools so that there's preventative education along the spectrum. And lastly, with that background in public health, I would like to serve on the Seattle Public Health Board to make sure that we do have comprehensive approaches to both preventative education and also comprehensive services so that all in our community have access to services. And with, I think, my lens as a person of color, as a woman of color, making sure that we consciously look at those who've been most left out and direct services there so that we are addressing the disproportionate numbers of folks in our community who have poor health outcomes.
Well, I think that part of the barrier for people in the African American community that are gay is some of the black churches just aren't accepting of people being gay. Some of them are still in favor of conversion therapy, and I think we need to change the social dynamic in addition to having better access to public health services. So we could do something here by maybe having PSAs, having more imagery of the acceptance of people of color being gay so that those individuals feel better about themselves. I actually had a gay employee that worked for me when I worked for a national insurance company, and he had to leave his home in Texas to come here because his family wasn't accepting of his sexual orientation. He felt very isolated and alone, and we need to embrace people and make them feel that they have a family, and then I think they'd be more inclined to get the medical help that they need.